Hi, this is Dr. Tom McDonagh from Good Therapy SF here in downtown San Francisco, and today I'm going to talk to you a little bit about a thought record. I've mentioned these before in earlier videos, so I thought I'd walk us through one, and that's a good way to kind of get a general idea. Although with thought records, the best way to really get a handle for these is to work through one yourself with a therapist. So I'll be doing the 5-step approach. There are a couple different variations. There's 3, there's 5, there's 7. I'll be taking the 5-step approach. So if you look at a thought record, the first column you're going to see is the situation. And it's really important when you're looking at the situation to be as specific as possible. For example, you want to say that incident I had on Tuesday at 3 o'clock with my neighbor, as opposed to all the incidences that I have with my neighbor. The more specific you can get, then the more accurate we can focus on the exact thought that you had, as opposed to a more general type of thought. So the more specific you can be with the situation, the better. The next column after you develop the situation is going to be identifying the thoughts and the emotions that you were having in that moment. When you're identifying the thoughts, we want to be able to just list as many as you possibly can, what was going through your mind at the time. Some can be a little bit more general, some can be a little bit more specific, but you want to try to get as many of those thoughts out there as possible. And what we're looking for is going to be something that we call the hot thought. The thought that is most specific, the one that kind of has the most energy, the one that really is causing the issue for you. And this hot thought is what we call an automatic thought, because it's happening automatically just beneath the surface of awareness without you really quite realizing that it's happening. So part of identifying the thought in this moment is going to be recognizing that this kind of subconscious thought is occurring and it's definitely influencing your mood. So with identifying the thoughts, you're also going to identify your moods, and sometimes it's easier just to know if you're angry, sad, maybe a little bit feeling dismissed or misunderstood. You don't have to get too specific with the moods. It's okay to just kind of have more of a general sense. Now, once you've identified what your most automatic thought is, the one that has the most juice, the one we call the hot thought, we then want to validate that thought in the next column, which is what we look at and we say it's the evidence for. What is the evidence that supports why you have that thought? That thought makes sense to you at some level, otherwise you wouldn't think it, right? So we want to support all the evidence why that thought's there. You can start with context for things that have happened to you in your life, maybe conversations that have led to this, maybe just some of your own personal reasons, but you want to have some evidence for why this hot thought is there. So you want to validate its existence. Then the column after evidence for is going to be evidence against, and this is the important one. We want to start noticing why maybe that hot thought, maybe that automatic thought isn't totally accurate. And this is where it's going to take a little bit of work, but you're going to have to grind and you're going to have to try to work hard to identify the evidence that does not support the automatic thought. So it's important here to initially validate the evidence for why you think that way. But then after you provide evidence for why you think that way, you then have to work to try to figure out what are some reasons why maybe you're not totally accurate, or maybe why that thought isn't 100% true. And then after you've gone through that exercise, that column, the evidence for why that thought's not true, or evidence that does not support the thought rather, we then kind of move into our final column, which is the more balanced column. And this is where you want to take a look at the situation, the thought, the emotion, the evidence for, and the evidence against. And then you want to really come to more of a concluding, more of an overview, more of a balanced statement. So, for example, I would say, let's say my situation, I'll kind of run through a situation here. My situation is I asked you to take out the trash on Tuesday night. My thought is that you should listen to me when I ask you to do something. The emotions that pop up for me are irritation. The evidence for why I feel this way is because I feel like there are things that I do in the household that contribute. So therefore, if I am contributing, you should listen to me. evidence that does not support my thought, right, that you should listen to me, would be not everyone's going to listen to us at times, right? Despite us asking, people aren't always going to listen to us. So what would my more balanced thought be? Well, I'm allowed to ask. Maybe I can be more direct in my ask next time, but also try to understand maybe there was a reason why that person did not choose to check out the trash at that time, right? It's kind of an easy example, but the point here is try to work through the entire event, and it allows you to step back, see what the thought is that's triggering, look at the evidence for, look at the evidence against, and then provide you with a more balanced perspective for what's going on. So again, my name is Dr. Tom McDonagh, and I'm from Good Therapy SF. Until the next video, take care.